This conference will now be recorded.
Good morning. Welcome to the Healthy Happens Here webinar series on tobacco cessation and available resources. I'm Candace Schottenlohr, a health educator with the Community Engagement Team with the Florida Department of Health in Miami-Dade County. And I also have my colleagues Brianna McDaniel and Robert Ward from the Community Engagement Team to help assist today with this webinar event and the Q&A later on in this discussion. And if you have any questions throughout the webinar, please remember to add them to the chat and you can share that with everyone. And just a few other reminders, please know that you have the capability to have your camera on or off, whichever you feel comfortable with. And you do have the option to mute and unmute your microphone. While you're not speaking, please remember to keep yourself muted. And today you will learn about the many benefits of being nicotine-free. In addition, you will be able to learn about local programs and initiatives that can help move you and others towards a tobacco-free lifestyle. And today, Nikki Chuck will be presenting to you on this topic. She is a senior health educator with the Florida Department of Health in Miami-Dade County and is a part of the Tobacco Prevention and Control Program. Thank you all so much for joining us, and we'll turn over to Nikki now.
Hello, good morning, everybody. Thank you for joining me today in this webinar, and I hope you are all staying safe and doing well. As Candace introduced me, I am with the Florida Department of Health, the Tobacco Prevention and Control Program. And today I will be presenting on available tobacco cessation resources, and I hope the information provided will help you learn more about the importance of living a tobacco-free life and the available tools to help tobacco and nicotine users quit. And next slide, please. Okay. I also wanted to take some time to mention the mission, vision, and core values of the Florida Department of Health so that everyone can understand how this presentation aligns with our organization. And our mission is to protect and promote the health of all people in Florida through integrated state, county, and community efforts. And our vision is to be the healthiest state in the nation. And our core values stand for ICARE, which mean innovation, collaboration, accountability, responsiveness, and excellent. We care about the health of all people in Florida and are a FAB accredited health department. This recognition from the Public Health Accreditation Board means that we have met the national standards to deliver the 10 essential public health services, and we are very proud of this accomplishment, and we always strive to help the community achieve better health outcomes through continued education and sharing of resources. And I'm very excited to be here with you all today to share some of the work that we do in our program. And next slide, please. Today's presentation objectives are to understand the Tobacco Prevention and Control Program initiatives, to understand the societal and economic burden imposed by tobacco use, discuss proven successful ways to quit tobacco. I think somebody's unmuted.
Give us 1 second. We're going to mute that person. Okay.
Thank you. Discuss proven successful ways to quit tobacco, discuss free cessation resources and tools available, and also to discuss additional resources available to assist your organization with developing an effective tobacco-free workplace policy. And I would like to mention, if you have any questions during the presentation, please place them in the chat box and I will answer them towards the end of the presentation. Thank you. And next slide, please. So I want to do a brief description of who we are and what we do. And next slide. So as part of the Tobacco Prevention and Control Program, I wanted to let you know that we are funded through Tobacco Free Florida. Many of you have probably heard about Tobacco Free Florida or have seen the different graphic quit commercials on TV or some of the radio ads. But did you also know that our program does not only focus on helping Floridians quit, we do a bunch of different initiatives and also policy work. The Tobacco Prevention and Control Program at the Florida Department of Health in Miami-Dade County is funded through a grant from Tobacco Free Florida, and our program focuses on improving the health of Miami-Dade County residents through different policy and systems change. And there are 4 main goals and program components that guide us. Our first goal is to prevent initiation of tobacco use among youth and young adults. And in order to accomplish this goal, we have 2 different initiatives that fall under it. The point of sale initiative, which basically educates the community and youth about the different marketing tactics big tobacco uses to try to get new smokers and young smokers to continue that habit throughout their lives. And also the Young Adult Interventions Initiative. And that one focuses on trying to reach out to different colleges, universities, and vocational colleges to encourage them to strengthen their smoke-free or tobacco-free policies. And if they don't have a policy in place, we also encourage that they work with us to help implement one. The second goal that we have is to eliminate secondhand smoke exposure. And we do this through working with Miami-Dade public housing and different condominiums to help promote smoke-free multi-unit housing policies. Our third goal is to promote cessation from tobacco use. And under this goal, we have the Tobacco-Free Worksites Initiative, which works with different employers throughout the county to try and assess their worksite and encourage them to have a tobacco-free policy or smoke-free policy if they don't have one already. And of course, promoting the Quit Your Way program and free cessation services, which you'll learn more about today. And then our fourth goal is to maintain infrastructure of students working against tobacco, known as SWAT, and the Tobacco Free Work Group of Miami-Dade County. These 2 community-based efforts place an emphasis on partnership and education, and with their help, the help of youth and community partners in Miami-Dade County, we can work towards educating them and also trying to change policy work in the county. And I would like to mention that policies are essential tools for supporting and improving and also advancing public health, which is why our SWAT youth and partnership members are very important to the work that we do. And next slide, please. I would also like to mention that Tobacco Free Florida does have a program present in all 67 counties throughout Florida. Tobacco Free Florida is a bureau of the Florida Department of Health, and their mission is to protect the people of Florida from the harmful effects of tobacco use. And the vision is a tobacco-free Florida. And as you can see towards the bottom, Miami-Dade County is what I'll be focusing on today. And next slide, please. So I'll give a brief description of the societal and economic impact of tobacco use. And next. So tobacco use is the #1 leading cause of preventable death in the United States and around the world. And you can see some of the data there on the slide. Tobacco use has killed 100 million people worldwide in the 20th century. And if these current trends continue, it will kill about 1 billion people in the 21st century. And that's quite scary. Every year, tobacco kills more than 480,000 Americans and nearly 6 million people worldwide. And the vast majority of these smokers started smoking as children. And as you can tell from the slide, these numbers also include deaths from smoking and secondhand smoke. For some local data, I also included the number of deaths every year in Florida. So 32,300 adults die every year from smoking in Florida, and you can note that this number does not include those who pass away from secondhand smoke. So the actual number of smoking related deaths in Florida is actually higher. And that's a lot of people. And next slide, please. Here are some additional facts about tobacco use and how it impacts the human population, and it takes a human toll. Tobacco use is the leading cause of preventable death and disease in the US, killing 480,000 Americans every single year, according to the CDC, and that is about 1 in 5 deaths every year. There is no risk-free level of secondhand smoke exposure, so even brief exposure can be harmful to your health, and everyone does react differently, but it's still harmful. And for every person who does die from tobacco use, at least 30 people live with a debilitating smoking-related illness. And next slide, please. Smoking impacts health negatively and causes many diseases, including the following listed on the slide. It can cause cancer, heart disease, stroke, lung diseases, diabetes, chronic obstructive pulmonary disease, such as emphysema and chronic bronchitis, and can also lead to poor wound healing, along with other health issues. And also, when I mention lung cancer from cigarettes, it's not only the lungs that smoking can affect, it can also create and lead to cervical, oral, and bladder cancer, as well as pancreatic, laryngeal, esophageal cancers, and colorectal cancers. Secondhand smoke is also associated with ear infections and can cause asthma attacks, especially in children, and being exposed to secondhand smoke can cause SIDS, or sudden infant death syndrome. So just some additional facts there. And next slide, please. The economic toll. So in addition to the human toll, smoking does take an economic toll. And as you can see from the slide, smoking costs Florida's economy about $16.96 billion a year. And the breakdown for that value is beneath it. $8.64 billion in smoking-related healthcare costs, and also $8.32 billion in lost workplace productivity. So as you can see, it's a very big toll on the economy. These amounts do not include health costs caused by exposure to secondhand smoke, which is also a very big component. And also it doesn't take into account smoking-related fires and also illnesses related to smokeless tobacco use or cigar and pipe smoking. And one additional fact is the average pack-a-day smoker in Florida spends more than $2,000 a year on cigarettes. So that is quite a lot of money. Okay, and next slide, please. Next, I'll talk about the proven successful ways to quit. And I really like this graphic that's on the slide because it depicts what our program through Tobacco Free Florida promotes. So it says, I have tried quitting cold turkey, but that has never worked for me. There has to be a better way. So we do not recommend quitting cold turkey, but instead we encourage smokers and tobacco users to use the free quit options available through Tobacco Free Florida and other available local resources. And also on the infographic, it says my reasons to quit include family, friends, money, and health, and that's all true. And next slide, please. So for the proven successful ways to quit, on the slide, you'll see a table that shows the different FDA-approved medications. I do want to stress that medication is highly effective with helping tobacco users to successfully quit. And since people respond differently to medications, it makes sense to ensure that smokers, tobacco, and nicotine users have access to many different choices when they are trying to do so. As you can see on the table, it shows 5 different types of nicotine replacement therapy. And towards the bottom, there are 2 prescription medications commonly used to support cessation attempts. All 7 of these are approved by the FDA to treat tobacco addiction, and that means that they are safe and effective. So I'll go through them briefly just to provide a short explanation. For the 5 available nicotine replacement therapies, the first one that you see is the patch. And for the nicotine patches, it helps to deliver a steady amount of nicotine to the body through the skin, and it is available over the counter, so in a supermarket or a pharmacy or a convenience store. and they have different strengths available. The second one is the gum, and the most common brand is Nicorette. It's also over the counter, and the nicotine gum helps to deliver nicotine to the brain more quickly than the patch, and it is designed to be chewed briefly and then held or parked towards the side of your mouth for a short interval of time in between your gum and cheek, and it helps to release nicotine into your bloodstream. The third one that you see on the table is the lozenge, and that one is the form of a hard candy. It also helps to release nicotine as it is slowly dissolved in the mouth, and each one lasts about 20 to 30 minutes, and it's also over the counter. The next two nicotine replacement therapies you'll see are both prescription medication. So for the nicotine inhaler, it helps to deliver a vaporized form of nicotine to the mouth through a mouthpiece attached to a plastic cartridge. And although it's called an inhaler, the device does not deliver nicotine to the lungs like a cigarette. Instead, most of the nicotine travels to the mouth and throat, where it is absorbed through the mucous membranes. And again, it's only available by prescription only. And the last nicotine replacement therapy on the table is the nasal spray. It is a pump bottle containing nicotine that you can squirt into your nose whenever you have an urge to smoke. And this is the fastest way to deliver nicotine into the bloodstream, and it is available by prescription. The last two medications you see on the table are non-nicotine pharmacotherapy options, and both of them are pills. For Chantix, that's the common name that it goes by for varenicline. It goes directly to the brain and blocks nicotine receptors from craving cigarettes. And when you start using Chantix, you are still smoking, but you cannot use any additional nicotine replacement therapy because that would have a combination effect. And Chantix is only available by prescription. The last medication is Zyban, and it helps to reduce nicotine withdrawal symptoms and the urge to smoke. It is a pill and also available by prescription only. Okay, and the next slide, please. I wanted to share some encouraging data. So about 70% of tobacco users do want to quit, and of them, half of them make a serious attempt each year. And also 80% of these smokers see a healthcare provider each year as well. So that's good news. And next slide, please. Next, I'll be talking about the free cessation and quit resources available throughout Florida. And cessation resources are available mainly through two organizations here in Florida: the Area Health Education Centers, or AHEC, and Tobacco Free Florida. And we are lucky enough in Miami-Dade County to have two AHECs available. And as you can see on the slide, we work closely with Miami-Dade AHEC and also the University of Miami AHEC, as well as Jackson Health System. The AHECs offer different counseling classes throughout Miami-Dade County, and they also offer in-person groups and worksite groups that are closed or open, which means if a specific worksite would like to offer these cessation classes on site to their employees, they just need to commit and have 6 people registered and also have a room available for the facilitator to come on site to help do the classes. Currently at this time, I do want to let you know that AHEC quit classes are being offered virtually through Zoom. And then of course, Tobacco Free Florida offers our Quit Your Way program, which I will be discussing more in depth. And next slide, please. So for Tobacco Free Florida's Quit Your Way program, it offers 4 different options that are listed here on the infographic. You can select the best one that works for you, and it's based on your preference or the smoker's preference, which is why the program is titled Quit Your Way. For tobacco users looking for a proven and effective way to quit, the best plan is to talk to their healthcare provider and also to determine which option works best for them. And in the next few slides, I will go into each option a little more in depth. And next slide, please. The first option is the group quit option, and it is led by a trained specialist. It also comes with 2 to 4 weeks of nicotine patches, gum, or lozenge, whichever the tobacco user feels is best for them. There are also convenient times and locations offered, as well as group support. And next slide, please. The next option available through Quit Your Way is the phone quit. And once the tobacco user or smoker registers, they have access to a 24-hour quit coach. It also comes with 2 weeks of nicotine patches or gum. They work together over the phone to create a custom plan. And there are 3 calls from the quit coach that they can get daily. To register for this one, they can call 1-877-YOU-CAN-NOW or 1-877-822-6669. And next slide, please. There's also the web quit option, and it's a free online program that registrants would go to sign up online and help create a personalized web-based quit plan for them. It is private and at their own pace, and it helps them track their progress. This option also comes with 2 weeks of nicotine patches or gum, and there are also motivational blogs with educational information available online. And next slide, please. The fourth option available through Quit Your Way and Tobacco Free Florida is the More Quit Tools option. It is available 24/7, and this one also comes with 2 weeks worth of nicotine patches. And it includes text messaging support, an email program, a free starter kit, and also a quit guide. So some additional tools to help. And next slide, please. Next, I'll talk a little bit more about the Area Health Education Center, or AHEC services available. The AHEC program offers 2 class types. As you can see on the slide, the Quit Smoking Now curriculum and the Tools to Quit curriculum. Both of these are offered in English and Spanish, and they were created based on clinical practice best guidelines. The guidelines suggest that cessation groups and nicotine replacement therapy, especially when combined together, can help increase a tobacco user's chance of successfully quitting. For the first curriculum, on the left-hand side, you can see for Quit Smoking Now, it is a 4-week course, and it's a 1-hour class each week. Some of the topics include stress management, relapse prevention, and the benefits of quitting. For this particular curriculum, when tobacco users sign up, it includes a 4-week supply of free nicotine replacement therapy. And the second curriculum, Tools to Quit, available on the right-hand side, it is a 2-week course, 1-hour class each week, or a one-time class that is 1.5 to 2 hours long. For this shorter curriculum, the facilitators help the smokers or tobacco users create a quit plan, and they also talk about the health effects of tobacco use and the benefits of quitting. And as mentioned, it also comes with a free 2-week supply of nicotine replacement therapy. Both types of classes will provide you with the valuable tools you need in order to help a smoker quit tobacco use. And then some additional topics that are discussed in these classes include dealing with withdrawal and nicotine cravings, understanding your triggers and identifying them, and also dealing with lifestyle adjustments and stress. And I wanted to mention that the Quit Smoking Now and Tools to Quit classes are held and offered by local area health education centers. They are both free and they provide NRT, and you can sign up online at www.ahectobacco.com or also through tobaccofreeflorida.com. The facilitators have received extensive training and have completed a tobacco overview, including addiction, nicotine replacement therapy use, motivational interviewing, and additional scenarios, case scenarios. Currently, both curriculums are being offered virtually and through Zoom. And the last thing I would like to mention is that the workbooks are mailed out to participants before the class, and the NRTs are also mailed out. And single or group class options are available, and these classes are not recorded to maintain privacy. And next slide, please. Next, I want to go over a few additional resources to assist with tobacco-free workplace policy change. And next slide. So some additional local resources that are available are through the Florida Department of Health in Miami-Dade County Tobacco Prevention and Control Program. Besides promoting free quit resources, our program also offers help with workplace policy change, development and implementation, and also just helping the employers and employees to know that additional free resources are available in case their health insurance doesn't cover that. And next slide, please. In addition, I also wanted to share some other services that the Tobacco Prevention and Control Program provides. We participate in a lot of community outreach events and educational activities. Well, currently not right now due to the coronavirus, but in the past, that is what we do. So if different work sites need any educational materials from us or quit materials, they can always reach out and we can either email them or figure out a way to provide them with the hard copy brochures. We also like to engage different work sites and employers through health fairs, events, and activities, and share different email and social media posts with them just to help promote our services and the resources available. And then lastly, we also like to encourage participation in National Tobacco Observance Days. And on the slide, you can see that I've listed two popular ones: the Take Down Tobacco National Day of Action, and also the Great American Smokeout. And there also is another one that I didn't have a graphic for, but World No Tobacco Day. So I wanted to mention that our program likes to help different community organizations and work sites with celebrating these tobacco observances. And next slide, please. And different ways to get involved. Local resources include the Consortium for a Healthier Miami-Dade Tobacco-Free Work Group, and the committee meets bi-monthly, the last Monday of the month, and currently all meetings are virtual through the GoToMeeting platform. But if you're interested in joining our work group and learning more about what we do in the community and just different tobacco prevention and control related initiatives, please feel free to call or visit www.healthymiamidade.org to learn more about multiple committees. And next slide, please. So to learn more about the Consortium for a Healthier Miami-Dade and the different committees offered, please visit the website listed there on the slide, healthymiamidade.org. Although we are socially distancing during this time, we can all still stay connected. So please follow us on our different social media platforms if you have those accounts. Our Facebook, our Twitter, and Instagram handles are listed there. Make healthy happen. And it would be great if you could share it with your contacts and also follow us and join and just work towards helping to make Miami-Dade a healthier place. Next slide, please. So here are the key takeaways from today's presentation. I wanted to reiterate that free cessation resources are available through Tobacco Free Florida and local area health education centers. And additionally, resources and technical assistance with worksite policy change are available through the Florida Department of Health Tobacco Prevention and Control Program, as well as Tobacco Free Florida. And next slide, please. Here are the links to different cessation resources that I talked about today. And if there are any questions, please let me know. And next slide, please. And it's my reference slide. So the references from the data that were mentioned earlier today can be found at these websites. And next slide, please.
Okay, thank you so much, Nikki. That was a wonderful job and learning more about the AHEC services as well as Tobacco Free Florida and also the local work that you all are doing, part of the Tobacco Free Work Group as well as the Florida Department of Health's Tobacco Control Prevention Program. And so now I will hand it over to Bree to share some of the questions that we have received from the participants.
Thank you, Candace. Like she said, we received a couple questions from you guys, those of you who have registered. So the first question that we received is, what are the steps to becoming a tobacco-free instructor?
Hi, Bree. Thank you for the question. So I just wanted to let everybody on the webinar know that to become a tobacco cessation facilitator, there are classes available through Miami-Dade AHEC. Those classes are geared towards medical staff, such as nurses. But if the person that submitted the question would like more information, or if they're interested in those classes, they can email me and I can connect them with the CEO from Miami-Dade AHEC.
Awesome, thanks. The second question that I have here is, which one can cause more harm to the body, regular cigarettes or the electronic ones?
Thank you, Bree. So for this particular question, I just wanted to note to the person that asked it is that while the long-term health effects of e-cigarettes are still not known, some of the ingredients in electronic cigarettes are aerosol, and they can become harmful to your lungs. The aerosol or vapor that users breathe from an e-cigarette device and exhale can contain many harmful and potentially harmful substances, including cancer-causing chemicals and heavy metals such as nickel, tin, and lead. And electronic cigarettes typically contain nicotine, which is also highly addictive.
And the last question that I have here is, how does tobacco smoke affect those who have allergies?
Okay. For secondhand smoke exposure for those with allergies, it can cause allergies to flare up or trigger asthma attacks or even make bronchitis worse. It can also irritate your eyes, nose, and throat as well. And as I mentioned previously in the presentation, it can cause ear infections and sudden infant death syndrome, especially in children. So those are the many different negative effects that tobacco smoke can have on those with allergies.
Awesome, thank you for answering those questions. I don't see any questions in the chat box. If you guys have any additional questions, please write them down or you can unmute your mic. But for now, I'll hand it over to Candace.
Thank you so much, Bree, and thank you, Nikki, for answering those questions. As mentioned, if there's any additional questions, you can go ahead and add them in the chat. I'll also share some more information on our webinar series that we are offering through the Florida Department of Health in Miami-Dade County, the Office of Community Health and Planning. So each month, we are trying to put on 3 to 4 events, and they will cover a variety of topics, including nutrition, mental health, tobacco cessation, and chronic disease self-management. Our next webinar is Monday, August 31st at 1 p.m. We will have an exercise physiologist, nutritionist come and speak about how to stay physically active, practice mindfulness, and keep a balanced diet to achieve a better well-being. And then some upcoming events that we have in September include on September 11th, Women's Health and Fitness, on the 25th, Tobacco and Pregnancy, What You Need to Know, And then on September 30th, the cholesterol basics. So stay tuned for that. And if you're interested to learn more, as Nikki mentioned, visit healthymiamidade.org and you can learn more about the consortium's work. Also visit the community calendar to learn about these events that are taking place virtually. And on my end, I do not see any other questions in the chat box. So we thank you all for your time. We hope you have a wonderful day. And if you have any questions, please do not hesitate to reach out to us. Thank you so much.
Thank you, Candace, Bree, Robert. Thank you, everyone.
Thank you, Nikki.